In today's video, I'm going to be talking to you about a very common condition that people get to know of, but they don't take any action on it. The condition is called fatty liver, and this is a condition that literally means excess amount of fat around the liver. For those of you who don't know me, my name is Dr. Arun Dhir. I'm a gastrointestinal surgeon, an author, and also a health and wellness mentor. Friends, fatty liver is now considered to be the #1 cause of liver failure in Western society, just to give you an idea. It is also called in medical terms non-alcoholic steatohepatitis, or NASH, or NAFLD. It's a condition which is common not only in adults but also in kids because of our overindulgence in lots of processed foods that our society engages in. The key thing to know about fatty liver is that it is only picked up incidentally when you get an ultrasound of the tummy for some unrelated reason, or you get some blood tests done. And when you go and ask your medical practitioners, most of the times, what can you do about it? They say, oh, just go and eat less fat. Well, that is actually not really the right answer, and we will come to that in a moment. But before we go down that path, it's important to know that fatty liver ultimately leads to the condition called a cirrhosis of liver, which is scarring of the liver, and that can lead to liver failure. That is, as I just said, the #1 cause of liver transplantation. It is associated with diabetes, associated with coronary artery disease, and very importantly can also lead to liver cancer. So what can we do about it? Well, the first thing is that if you are someone who is kind of slightly overweight, well, let's do a quick test first. The test is something that you can do right now. So just follow me. All you need to do is take your shoes off, stand against a wall or a bookcase, in which that's what I'm doing at the moment, in a way that your heels are touching the bottom of the wall, basically. And your shoulders need to be touching the wall as well. So don't move your heels and don't move your shoulders. And what I'll get you to do is slowly bend your head down. Your shoulders still need to keep touching the wall, so just make sure that you're doing that. And bend forward and see if you are able to see the tips of your toes. That's the most important thing. If you are able to see the tips of your toes, that means you are doing well. You are very unlikely to have fatty liver. Of course, this is a very rough initial test, but it's a very good screening test. If you are not able to see your toes, which means you are carrying a lot of fat in the middle part in the abdomen, and it is probably wise to go and see your GP about it and get an ultrasound. But here are the things, friends, that you can do in order to assess and in order to help you with your fatty liver. #1, cut out the hidden sugars in your diet, such as the pastas and the breads and the bagels and the biscuits and things like that. #2, replace alcohol with things like green tea. Green tea is rich in antioxidants and polyphenols, which are really helpful in detoxifying the liver. #3, eat good fats. Now you might say, this is very counterintuitive. I've got a fatty liver and you're asking me to eat fats. Well, I'm asking you to eat good fats because good fats are rich in omega-3 fatty acids, such as almonds, such as walnuts. You can also use seeds such as flax seeds. Flaxseed oil is in fact really good for fatty liver. And the other thing is avocado, again rich in natural plant-based omega-3 fatty acids, really help in detoxifying. The other thing is ginger. Use of ginger, which is a root, is found to be really helpful in improving your digestion and also fatty liver. You can have it like ginger tea. You can also use like thin slices of ginger which are soaked in vinegar, and I recommend using the 5th strategy, is that of apple cider vinegar. You can actually chop small slices of ginger, soak it in apple cider vinegar, and you can take it with a meal. Try not to take ginger empty stomach because sometimes it can cause an irritation. So those are my 5 tips of how you can start improving your fatty liver condition, it's always a good thing to go and get it checked out with your GP, who may need to do some blood tests and ultrasound. Your general practitioner is the best person to guide you. But if you would like to get in touch with me or gain further information, check out my website on www.centerforweightloss.com.au, or subscribe to my channel and stay in touch with all the videos and the information that I am presenting. Thank you once again, and stay safe.